Okay, so the last section is going to be about public health, and again, it may be an individual's question, and how do these people help improve and stick to the BDA again. So, Chadwick, for example, nobody really knew how poor people were, so he actually went into the cities, and he said that they had much lower life expectancy than the people who lived in the country. He believed that the town cities should build clean water, which should come from local taxation. So it led to the 1848 Public Health Act, but that was not compulsory and was not in London. He was attacked by the newspapers because they didn't want to build and spend money on poor people. John Snow, well, before John Snow, people didn't realise how the disease cholera was spread. And in 1854 there was a massive outbreak. He believed it's caused by contaminated water. He used scientific methods to map out the deaths, and he persuaded them to shut down that pump on Broad Street. By doing that, he used statistics, how disease was spread, and these days that is used all the time. Charles Booth investigated people in the East End, realised how poor people were, and he said that the government should be responsible for improving conditions, and he pushed for the introduction of old age pensions. And he didn't this because he was a nice guy, he did this because he was concerned about a working class revolution. Joseph Rowntree, the rich owner of Rowntree's factory, discovered that many of his own workers were living in abject poverty, and he believed that well-fed and healthy workers were more efficient. Increased their pay. Guess what? Massive increase in output and a huge reduction in poverty in York. These guys to him were really important. Beveridge published the report that health and social care was for all. Bevan was the Labour Minister who introduced the NHS, and the impact was unemployment, child benefit, and most importantly, free healthcare for the NHS. So, public health obviously goes all the way back to Roman times, and the key thing about Roman times is that was primarily, if we look, and this will be a factors question, why did they do in Rome was because of a war. They needed a healthy population. They also, the Romans, had a strong government. They also developed that waterproof technology which enabled them to build aqueducts, etc. People were more educated in Rome. Individuals also planned the sewage systems, and they had a rich, wealthy base slave economy to do that. So it's well worth going through an individual time periods. I'd stick to public health, I'd stick to Rome, go back and find out what the factors were. I'd go back to medieval times. In medieval times, war affected it because they were spending too much money on wars and not on public health. The government in medieval times was weak. They lacked the technology really to make massive improvements. The economy was up and down and reliant on the king. People became less educated, so really during medieval times it was a backward step. When did it become more popular, or when did it come? Well, by about 1750, when the population was increasing, it was overcrowded and bad housing. When new diseases hit, then that's when they needed to do something about it. So after voters got the work in 1867, they pushed for the 1875 Public Health Act, which created the welfare state.